Hey everyone! Today, I'm going to break down the key differences between asthma and bronchitis so you can know the signs and solutions. Ready? Let's dive in. First up, definitions. Asthma is a chronic condition where your airways become inflamed and narrow, making it hard to breathe. Bronchitis, on the other hand, is inflammation of the bronchial tubes that carry air to your lungs. It can be acute, lasting a few weeks, or chronic, lasting months or even years. Now, onto symptoms. Asthma symptoms include wheezing, shortness of breath, chest tightness, and coughing, especially at night or early morning. Bronchitis also involves coughing, often with mucus, fatigue, shortness of breath, and a slight fever. The difference? Bronchitis coughs tend to bring up mucus, while asthma coughs are usually dry. So what triggers these conditions? Asthma can be triggered by allergens like pollen, dust mites, pet dander, pollution, exercise, cold air, and stress. Bronchitis is often caused by viral infections, smoking, and air pollution. It's worth noting that both can be hereditary. Let's talk acute versus chronic forms. Acute bronchitis is usually short-term, often following a cold or flu. Chronic bronchitis, however, is a long-term condition, often part of chronic obstructive pulmonary disease, or COPD. Asthma, by definition, is chronic but can have acute flare-ups. How are asthma and bronchitis diagnosed? For asthma, doctors typically use lung function tests like spirometry, peak flow measurement, and sometimes allergy testing. For bronchitis, a physical exam, chest X-ray, and sputum tests can be used. Standard treatment options? For asthma, inhalers are a common go-to, alongside medications like corticosteroids, bronchodilators, and leukotriene modifiers. Bronchitis treatment may involve rest, fluids, inhalers, and sometimes antibiotics if a bacterial infection is present. Natural remedies like ginger, honey, and steam inhalation can help both conditions. Now, what about triggers and how to prevent flare-ups? For asthma, avoid allergens, use air purifiers, and manage stress. For bronchitis, quit smoking, avoid polluted areas, and get vaccinated against flu and pneumonia. Can these conditions be cured? Asthma is generally a lifelong condition requiring ongoing management. Acute bronchitis can be cured, but chronic bronchitis is long-term and requires continuous care to manage symptoms and prevent progression to COPD. Finally, let's look at environmental and lifestyle factors. Smoking or vaping is a big no-no for both asthma and bronchitis. Poor air quality can exacerbate symptoms, so keep your environment clean. A balanced diet and regular exercise can strengthen your immune system and improve lung function. So there you have it. Understanding the differences between asthma and bronchitis, knowing the symptoms, triggers, and treatments can help you manage these conditions effectively. Got questions? Drop them in the comments below. Don't forget to like, subscribe, and hit that bell icon for more health tips. Stay healthy, everyone.